Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lily Shockney.
Hi, this is Lily Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. We hear the terms mindfulness and meditation a lot in the news. So what are the current day roles of these ancient practices? My guest today is Dr. Neda Gould, a clinical psychologist and assistant professor of psychiatry and behavioral science at Johns Hopkins. What exactly is mindful meditation?
Well, you're right. It's become a very popular term, but the concept is actually pretty simple. It's being aware of the present moment, but in a particular way, so with some curiosity and openness and without judgment. So really noticing what's happening inside our bodies as well as in our external environment, but without judging it as good or bad.
So how often should we be practicing this, and how often and for what duration is considered to be the most effective?
It's a wonderful question. I think I'm asked that a lot, and what I say to people is that the more you do, the better. But of course, we're not going to spend our entire days doing formal meditation practices. And so there are a couple of answers. One is to make the practice fit your lifestyle. So whatever you think you can do to make it a long-term commitment.
Okay.
And for some people, that might mean 10 minutes a day. For some people, that might be an hour or more a day. But I suggest trying to build up to 20 minutes daily.
Is there a time of day that it's better to do?
And again, fitting it into your schedule is the most important thing. So many people like to do it in the morning because it sets a framework for the day where you can bring some of the mindfulness to your daily activities. But that just may not be feasible for many people where the mornings are very rushed. And so you can practice during the daytime, you can practice in the evening, or all three. And every day could look a little bit different. But I think what we want to do is try to create a habit.
We all feel like we're in the fast lane. I think especially women that are juggling family and work and children and lots of other things. How can mindfulness potentially reduce our stress?
Yeah. To step back and kind of think about our stress response, we also think about it as it's called the fight or flight response. And this system is set in place to protect us in moments of danger. The issue with our daily lives today is that most of the time the stress response turns on and there is no danger to our physical integrity. It's often a thought that we have about what could happen or should happen, or thoughts we've had about the past, and those turn on the stress response, or situations that may be a psychological or a social threat. And so mindfulness can help by allowing us to notice those thoughts that might trigger the stress response, or those stories that we get caught up in, and to bring us back to the facts and to the present moment, and just to be with that. So we get some distance from some of those stressful thoughts that might trigger the stress response.
That's very, very clever and very interesting. What are conditions that mindful meditation can help, such as we certainly do have individuals that are dealing with chronic pain, for example, obesity, smoking cessation. How can it fit in with some of these conditions?
Absolutely. Yes, it's become a very, very popular area of research, and I'm really happy about that because I think it's a very important area of research. Some of the most robust findings are in the areas of psychological health. So across clinical and non-clinical populations, what we see is improvements in anxiety and depression and stress. And also, as you mentioned, in pain, so there's a lot of convincing research and literature that shows that with mindfulness practice, there's improvement in functioning with pain, as well as how much the pain interferes with daily life.
And how about smoking cessation? Does it have a role there?
Absolutely. So there have been some reviews and research, and also some books that some well-known mindfulness teachers have written about these habits, such as smoking. So one book was written by Judson Brewer that specifically targets the craving associated with these different addictions. But
and food too, no doubt.
Absolutely.
Yep.
You know, if you think of it broadly, what mindfulness does is creates a pause for us. So we stop. And in that pause, we can sometimes make a different decision. So what's happening is that we break out of those automatic habits that might result in negative decision making.
Like opening the refrigerator.
That's exactly right. So we can pause, and in that pause, we might be able to make a different decision sometimes.
Got it. So how does mindfulness affect functions of our brain?
Yeah, and that's a fascinating area of research. And one of the really interesting parts, and the part that might translate most to what we see in terms of stress reduction, is that the part of the brain responsible for the fight or flight response, it's called the amygdala, with continued mindfulness practice, that part of the brain doesn't turn on as frequently. And when it turns on, we have the tools to turn it off more readily. And so that's a really fascinating part of the brain research. And also what happens is we see that the wiser parts of our brain, so the parts of our brains that make us uniquely human, the frontal lobes of our brain, become more active. So we begin to make better decisions because we're engaging those parts of the brain more than the primitive parts of our brain that just react to situations.
How about for memory?
Yeah. And absolutely, you know, one way to think about the memory is that we're more likely to remember something if we pay attention to it. And mindfulness allows us to pay attention to a situation, so it's more likely to get encoded. But there's also some fascinating research that with continued mindfulness practice, the part of the brain that's involved in memory formation, the hippocampus, sometimes even grows new neurons as a result of mindfulness practices. So really fascinating.
That's incredible. Absolutely. So how have you personally found mindfulness to be helpful?
Yeah, you know, when I turned to mindfulness about 10 years ago, I took a course called the Mindfulness-Based Stress Reduction course, which is an internationally offered course and one that I teach now myself. And it was really a life-changing concept for me to live in the present moment. And I think how it really helped me is to, as I mentioned earlier, notice my thoughts, but not feel as though they were necessarily all true or that I had to react to all of them. And to bring my attention back to just what was in the moment was really a novel concept for me. And I really saw that it did, in fact, reduce my stress, improve my sleep, and allow me that space to see things more broadly and make better decisions as a result.
That's fascinating. What are some myths about mindfulness?
Yeah. So I think the first one that's really popular is people think they have to clear their mind of thoughts.
Yes, that's what I thought when I was first learning about this too,
and
was
so,
empty my brain.
That's right. And so I think it's a relief for people to realize that we're not actually trying to empty the brain in mindfulness practice, but we're beginning to just notice the patterns of our thinking, notice our thoughts without judging them or without trying to push them away or cling to them.
Which I think should be easier than trying to empty our brain, right? I think it's very hard to say I'm not going to think about these things anymore, because that just makes you think of them constantly and worry about them.
That's exactly
constantly.
right. And then people start thinking, oh, I can't do this. It's not working.
Yes, you set up to fail before you even start.
That's exactly right. And I think other myths are that people think that they don't have time to practice and that they're not going to be efficient if they practice. And what we actually know is that if you do take that time aside, even though it does take time out of your day, if you do take that time aside to practice, you're actually more productive and you enjoy the tasks that you're doing to a greater degree.
That's wonderful. So if people aren't doing this yet, we really do need to get them engaged because it's going to benefit them in pretty extraordinary ways. How can we practice mindfulness? For example, give us some information as to what we should be doing in order to be mindful.
Absolutely. So there are two ways to think about mindfulness. And one is a formal meditation practice, which is what might come to mind, where we sit on a chair or a cushion and we might bring attention to our breathing. So that's a formal meditation practice. And then there are informal ways we can bring mindfulness into our days. So every moment of every day, we could just pause and notice what's happening in our senses, for example. Our senses are always in the present moment. And so we just note in a couple of words what's happening in our senses. In terms of the formal meditation practice, my recommendation might be to start small and to start with some guided practices. So there are a few resources that I could suggest that at the end that people could begin to use to start. And then if they'd like to grow the practice from there, they can do so.
I've heard about eating a meal mindfully. What would that involve?
Yeah, a lot of people ask that. What is eating mindfully? So I suggest that people think about how they ate their last meal. For many of us, it's being at the computer or checking our phone simultaneously, or even while we're driving. And eating mindfully is to be with the food, to notice it in its entirety, to notice the sense of smell and sight and sense the food going into our mouth and really slowing down and savoring. And it's, of course, best done if we can do it alone. But you can do it at any time by just not being on automatic pilot when you eat. And it really, we do eat less and we enjoy the food more when we eat mindfully.
Which makes sense why it can help with issues of obesity.
That's exactly right.
What does the expression mean, drop the story?
One of my favorite tools that I've picked up along the way. And so when we're faced with a stressful event, we have the event itself that's stressful, and then we have the story, the add-on thoughts that we add to that stressful event. So for example, if you're running late, you're already running late and that's stressful, but then you think, oh my gosh, what if my supervisor is going to be mad at me? And what if I lose my job? All those stories that likely don't happen. And so with dropping the story is a tool that one could use by just stating the facts. I'm late. And then noticing when the mind likes to travel to all of the catastrophic thoughts associated, worst case scenarios, that's right. And then returning back to the facts, the only part that's true. I'm running late.
So that's interesting. I will certainly begin using this then I worry about snow. Back in 1984, decades ago, right? I was in a serious car accident and broke my arm and leg, and it was in snow and ice. So since then, if I just hear the word snow, I start worrying. So I'll watch the news and they'll say there's a chance of snow. And I've already fast forwarded my life to the next day that I have to drive the car somewhere and I'm going to be in snow. So of course I'm going to have an accident and then I'm going to go to the hospital. I'm going to be in plaster. If I think about it, I don't even have anywhere to go tomorrow, so it can snow all it wants. It doesn't matter. So thank you for telling me that. I'm going to drop that story.
It's a wonderful example of how our brains can torture us.
Absolutely. And you've used the word pause quite a few times as we've been sitting here having this conversation. That's a key word, isn't it? And something that we don't do in our daily lives. We're just fast forward continuously. Hurry up. How much can women multitask? And being able to hit that pause button. I think I'm going to type up a little sign for myself and put on my desk and also in the kitchen on the counter that just says pause.
Yeah.
See if that helps. What are some of the resources that people can use if they would like to give mindfulness a try?
Mm-hmm. So a lot of people like to use apps, and if you're an individual who has your phone with you all the time, which is most of us, an app can be a very useful place to start. And there are many apps out there, but some of the most popular are the Calm app and Headspace.
Headspace.
Yeah, those
Clever.
two. Yeah, those two are popular ones, and the nice thing about apps like that is that they have short meditations daily that they'll unlock for you, and so they're guided and it's structured, so it kind of begins to help you create that habit.
And are they different lengths?
Yes, exactly. So you can pick and choose. You can create a group of them that maybe you like the most, that you're most likely to use, and they have ones that are good for sleep and ones that might be good for anxiety and stress and mood. So they're very comprehensive apps, and I do recommend those. There's also a couple of websites that I recommend to individuals, and one is the UCLA Mindful Awareness Research Center, and they have a whole list of free guided meditations. So if you Google UCLA MARC, M-A-R-C, they have a lot of guided meditations. And then also UCSD, University of California, San Diego, they have a mindfulness-based professional training institute. And again, they have a whole list of mindfulness resources, including free guided audio.
That's fabulous. Well, those are all excellent resources for us to share with the individuals that are listening to us today. And I'm going to hope that they become mindful. I know that I certainly will begin some of these practices to reduce my stress. So thank you so much, Dr. Gould, for sharing your expertise today. And I hope you've learned the place of mindfulness in managing our health in today's world. I'm Lily Shockney. Please join us on the first Thursday of each month when we'll be discussing Insights That Matter, a monthly podcast for A Woman's Journey at Johns Hopkins.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lily Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from BioSense Webster, Boston Scientific, and Keswick Wise and Wellness Center that support our podcast series, Insights That Matter. For more information about A Woman's Journey, visit our website, hopkinsmedicine.org/A Woman's Journey, and like us on Facebook and Twitter. Until next time, stay well.